Good morning all. Today we are going to see about the condition rheumatic arthritis. First of all, I would like to say what is meant by rheumatoid arthritis. Rheumatoid arthritis is an autoimmune disorder in which immune system identify the synovial membrane as a foreign and begins to attacking it. So here the synovial joints become inflamed. The picture it's showing the inflamed synovial joint. So next I would like to say about the definition of the rheumatoid arthritis. Rheumatoid arthritis is a chronic inflammatory disorder that may affect many tissues and organs but mainly attacks the joint, producing as an inflammatory synovitis. So I think people understand about the rheumatoid arthritis. And the next risk factor. In this risk factor, it's mainly about the idiopathic. We doesn't know idiopathic, which means idiopathic unknown. We doesn't know what is the exact cause of arthritis. And next, positive family history, inherited tissues, type major, histocompatibility complexes, and smoking, bacterial and fungal infection, herpes simplex virus infection, Epstein-Barr virus, certain type of vitamin D deficiency that may cause the rheumatoid arthritis. So next, sometimes autoimmunity also cause the rheumatoid arthritis. Next incident. In incident, rheumatoid arthritis affects 0.5 to 1.0% of population in USA. Female is more than risk factor of comparing female and male. Female is only risk under this, but people of age, any age can be affected with this age, but peak age about 45 to 65 age. They are under the risk. About 70% of the women, the disease strike women 3 times more than men. And next, pathophysiology. As I would like to say about the pathophysiology in here, presentation of antigen to T cells. These T cells and B cells make proliferation in the synovial line. This proliferation. So here the neutrophil, that will be accumulation in the synovial fluid joint. So this may cause the synovitis. Synovitis means inflammation of the synovial joint, and early pannus formation will be occur here. I would like to say what is meant by pannus. The pannus is a sheet of inflammatory granulation tissues that spread from the synovial membrane and invades the joint. So pannus formation here, the highly vascular granulation forms within the joint. It evenly covers the entire surface of the articular cartilage. This produces the inflammatory cytokinase in the pannus cartilage junctions, further contribute the cartilage destruction. So it may cause the subchondral bone erosion, pannus invasion of the cartilage of chondrine proliferation, laxity of ligaments. It may cause joint instability, contracture, and decrease the range of motion exercise. And the laxity ligaments cause a joint instability, contraction, decreased ROM, and systemic complication occur. So next, I would like to say about what are the signs and symptoms in rheumatoid arthritis. Here, the joints of the hands are often very first joints affected rheumatoid arthritis. These joints are swollen, red, and tender when squeezed. So, the picture shows the rheumatoid arthritis hands. There is the we can see in the synovial joint membranes become thickened, and there is a synovial fluid, and then degenerated cartilage we can see in this picture itself. So this is the picture of rheumatoid arthritis hands. Very clearly we can see in this picture. And next is fan neck deformity. Here the deformity arises from the hyperextension of the proximal interphalangeal joint, which while the distal interphalangeal joint is flexed. So here when you flex the interphalangeal joint flexed, it will be when we flex the distal phalangeal, proximal phalangeal become hyperextension, that is fan neck reflex. And next, mallet finger. In mallet finger, a simple flexion deformity of the distal interphalangeal joint preventing the extension. So here distal part of the interphalangeal prevent the extension of the joints. So here the next one is the deformity of the thumb. Severe hyperextension of the interphalangeal joint of the thumb. Here the thumbs become hyperextension. So picture itself we can see normally. Next, the patients may experience the fatigue, joint pain, joint tenderness, joint swelling, joint redness, and then joint warmth. The joints become very warmth. These are the symptoms we can see in these rheumatoid arthritis patients. Joint stiffness, loss of joint range of motion, many joints affected, polyarthritis, and the next joint deformity. Both sides of the body may affected, right and left side of the body may affected with this. Next, diagnostic evaluation. When you are seeing the diagnostic evaluation, we have to collect the complete history collection and physical examination, and next we move on to X-ray. X-ray of the hands, feet, and generally performed in the people with the rheumatoid arthritis. Magnetic resonance imaging, we have to done the MRI, and then USG we have to do, and then this blood test. Here in blood test, rheumatoid factor we have to examine. Rheumatoid factor is a specific antibody in the blood. A negative rheumatoid factors does not rule the rheumatoid arthritis. The arthritis that comes zero negative most of the during first year of the lines, converting in the zero positive status over time. So next, anti-circulating protein antibodies we have to done, and erythrocyte sedimentation we have to do, and next is C-reactive protein. The protein found in the blood responds to the inflammation. Full blood count, give information about the blood cells. Renal function test we have to do, and liver enzyme we have to examine the patient. So these are the investigation we have to do for the rheumatoid arthritis patient. Next we move on the medical management. So in the medical management we start with the drug therapy. So here we are administering the salicylate, acetylate, aspirin, and non-acetylate like choline, magnesium, trisalicylate, and then choline salicylate we are preferring here. So next, non-steroidal anti-inflammatory drugs. Here NSAID we are preferring diclofenac, etodolac, and then fluorophrofen, ibuprofen, meclofenamate, meloxicam, and then abutamate. These are the medicines we are using as a non-steroidal anti-inflammatory drugs. And then next, anti-malarial drugs we are using here, like hydrochloroquine, chloroquine we are preferring here for the reduce the inflammatory. And next, immune suppressive medicine we are preferring here, methotrexate, and then azathioprine, imuran, and then cyclophosphamide, cytotoxin. These are the immunosuppressive medicines we are giving. It helps to reduce the antigen antibody reactions. Already we know it's completely arrest our immune system, autoimmune disorder. So here we are preferring that. And in addition, for the reduce the inflammatory purpose, we are using the corticosteroid also. So here prednisone, hydrocortisone, intraarticular injection we are preferring here, and then topical analgesic like capsaicin, and then Sostrex. These are we are using here. Next we move on the surgical management. In surgical management, surgery is considered for people who have severe rheumatoid arthritis include. We are doing the arthroplasty. So here they are replacing the part of all joints such as the hip or knee. They are doing arthroplasty. Hip or knee we are preferring here. And next, arthroscopy, which used to small lighted instruments to remove the debris of inflamed synovial tissue from the joint. Carpal tunnel release we are doing, and the cervical spine fusion to treat the severe neck pain and the nerve problems. Finger hand surgeries to correct the joint problems in the hand, and foot surgery like phalangeal head resection, synovectomy to remove the inflamed joint of synovius. I think people understand about the surgical management. Next we move on the nursing management. In nursing diagnosis we include the patient may have the pain. First of all we know about that. So here acute and chronic pain related to the inflamed and inflammation and increased disease activity, tissue damage, and then fatigue, lower tolerance level, and fatigue they experience due to the pain, inadequate sleep. Patient is having disturbed sleep pattern related to the pain, depression, and the medication, and then self-guard deficit related to the contraction and fatigue. Loss of motions will be there, range of motion exercise loss. So thank you.